Hi, everyone. Vic Gatto. Thanks for tuning into the Health Storm. Today I have Gordon Jones. He's a health innovator, great background, wide-ranging. He started with a PhD in health administration, worked in hospitals, did several startups in health tech, and now he's an innovator around nutrition and diet. Great show. I really dive into a lot of different areas. Tune in. I think you'll really enjoy it. Again, Vic Gatto with Gordon Jones. Thanks a lot. Thanks for doing this. I appreciate you coming on the Health Storm. It's kind of a wild time in the health market today with COVID-19 and all the public health scares. I appreciate you making time to do this.
Oh, my pleasure. I appreciate it. And I mean, I know we can be talking for hours about this subject. So.
Yeah, I know. So just for the audience, give a little about your background. You've done lots of things in health innovation, health administration, came out of the military. Give a quick description about it.
Yeah, so I have my doctorate and my master's in health administration, but I can't really say I have been a hospital administrator. I did my residency in a children's hospital, academic medical center, 7,500 employees, the academia embedded in there.
Yeah.
And I really didn't take well to that environment. So
yeah, I mean, you wouldn't be an entrepreneur if you really did well in that environment.
No, it's terrible. I mean, you got an idea and it's like 10 years before it gets implemented, right? So I actually started working with physicians pretty much right out of the start. And but innovative there, we were organizing physicians into primary care physicians into independent physician associations so they could take full risk managed care contracts. And this was in the Southeast
in what
the
year?
early 90s.
Yeah, that was early.
That was way. I signed the first full risk contract with Blue Cross Blue Shield of South Carolina in 94. Wow. They had never done that before.
Yeah, right.
And so that was unique. And then I realized that we couldn't do that. We couldn't manage a full risk life of a patient without information systems, and we didn't have them. We were doing everything by paper and fax.
Yeah.
And so that's in 97, I switched over to health tech and joined, it's National Data Corporation. It was a credit card processing company out of Atlanta that built the pharmacy claims process on a credit card platform.
Interesting.
Because it was such a small transaction set, they could do that. And then they grew into one of the largest health information technology companies. But now they're a part of McKesson. So, so that's where I cut my teeth from a corporate standpoint in health tech. And then in 2000, went out on my own, and I've been doing startups and creating new types of innovations.
Yeah, for 20 years. Like that. Yeah.
Yeah. We developed the first web-based physician billing application. So we would actually have the physicians put their billing into our web-based application that would come to us, and then we would send it off to the payer. So we were on the front end web-based and on the back end the traditional EDI model, but it was a really good interface. And that was in 2000. So that was right as the bubble was bursting on the internet speak. But and then since then, I've done mobile apps and wearables and a whole bunch of different.
Yeah. I mean, the reason I wanted to talk to you is you've done a myriad of different initiatives all around health tech, health innovation, diet, how they're all interrelated, really. Do you think that's fair?
Yeah. So down the health tech track, we actually started to develop a blockchain solution for healthcare.
Okay.
The problem was that was in 2017 to 2018. And so there are two forces that came to put the P-squash on that. One was called the payers, and the other was called the SEC.
Yeah, the federal government.
And so that project kind of went away, and I started looking about, okay, so where can I really try to make an impact on people's health? And my family, so we've adopted 5 special needs kids, my wife and I have. And so we've been spending the last 12 years of our marriage dealing with all of that.
Yeah.
And one of the
What's
smartest.
the age range? What are they? What, 5?
So our youngest is 10, 13, 14, 18, 26. And our 26-year-old has our 4-year-old granddaughter who gets to hang out with our homeschooling that we have going on at home right now during the day. But the smartest thing we did about 10 years ago was we bought a service from a company that sources all natural organic meats and vegetables from farms here in the Southeast, processes it, prepares it so that they've never had a food recall in the history of the company. They've been around since 1954. They vine ripen the vegetables so you get the highest concentration of nutrients in the food, and then it's flash frozen to 75 degrees below zero, so you're knocking out all of the aerobic and anaerobic bacteria. So they've never had a food recall on it for foodborne illness. So anyway, as soon as we started adopting, we decided to go that way. And our daughter, our first adopted child, came to us on 9 meds.
Wow.
Within 18 months, we had her off of every single med. And we attributed a lot of it to eating healthy. And so we've been doing that for a long time. So last September, October, I started analyzing what we were doing to see why we're staying so healthy, even though we had these special needs kids. And it was primarily the food, I thought, or I believe.
Yeah.
And so found out the company actually allows their customers to refer and make money doing referrals. Yeah. So now I've just been promoting the heck out of the service because it just benefits everybody. I mean, at the end of the day, there's the environmental factors that are going on, genetic factors that you might have. All of that only equals up to 20% of your health status. Everything else is based upon what we put in our mouth. Everything.
Yeah.
Both from a disease standpoint and then the ability to end our disease is all based on the types of food we put into our mouths and that our bodies digest.
So I want to add into that, but just like your background is really interesting because you come from hospital administration and then health tech and processing, and then a lot of kind of personal interest and your family interest in diet and how that relates to health. So it's sort of lots of different views of this elephant that is the healthcare system.
Yeah. Well, and that's what lends me just the credibility to kind of talk about this is because we've lived it as a family.
Yeah, right.
And but now we're looking at, okay, now how can we take the idea of, okay, we have to eat healthy. The best types of foods to eat are all natural and organic, which means there's no hormones, steroids, antibiotics, or the food's not grown with pesticides or any of that stuff. But then how can we leverage some technology on top of that to do along the same lines? And I've recently found a company that they'll do a DNA test. And all of their analysis is specifically on what nutrients are you deficient in based upon your DNA, your genetic makeup. So even though it's still kind of a static picture of your health, so it's not like what I need today, it's just what I need from a genetic makeup. But they'll actually custom design the supplemental nutrients that you can take based upon your genetic makeup.
Yeah.
And so now we're starting to push technology into how we ingest the right combinations of nutrients And then we can dive in. I mean, I don't know if you want to get into all the cellular stuff that goes on at that level, but
yeah, I mean, it's all of it, right? There's let's get people off. I love your crap food. We need to get people off eating processed, not good for you food.
Yeah, so everybody out there, we're not talking caca. We're talking calorie rich and processed foods, and really the rich is even enriched. So, but that's what I call crap foods for sure.
Right. Yeah. CRAP, calorie enriched and processed. Right. We need to get people away from that and towards farm to table or locally grown organic. Then I want to add in. I really like
locally grown is good for the farmers, local farm, but they're not all growing their stuff organically. So that is one thing you have to be not wary of, but just know that you're going to want to ask those questions when you go to the farmers market, just to make sure that you have an idea where they're getting it. And that's the one good thing about the company that we work with. They vetted all the farms.
Right.
I mean, they know the farmers and they know how their process is, and they vetted it because they're buying hundreds of thousands of pieces of.
And then I think you add in the DNA testing. I'm really interested in probiotics as well. I think the gut health is a little different than regular nutrition, but very intertwined. And
everything. If you think about your gut biome, is really what drives your health. So Dr. Gundry, Stephen Gundry. He's the longevity paradox doctor, but he's got a really good in-depth discussion around. It's not really what you put into your mouth; it's actually what your gut digests.
Yeah,
and that's where the important stuff really happens. But yeah, I agree with you.
If you have a healthy biome and you starve all those kind of friendly bugs down there, then you're not you're really kind of starving yourself.
And that's the thing about probiotics. So probiotics are just adding in more good biome gut buddies is what he calls them. But if you're what you're eating and everything counteracts that and kills off the good and enhances the bad, then a probiotic isn't really even helping you. What you need is a prebiotic.
Right.
So what a prebiotic does is it feeds it's what the good biome likes to eat, and then they'll multiply.
Right.
And then so there'll be more. So even if you're on a bad diet, if you're doing prebiotics, then that'll actually grow your ability to counteract all that.
Yeah, and we had an entire show on that with a new product called Nori, but it's really fascinating stuff. I think. So let's talk about COVID-19. So the show is the Hellstorm. I named it 6 months ago.
Yeah, and it's coming at us, man. It's hitting us hard.
I mean, I thought the storm was going to come. So this was late 2019. I thought the storm was going to be several years away, and we could prepare for it. And then all of a sudden, it's here. I mean, it's the storm has come, and we're in crisis mode. My thesis is that this is, of course, right now we're in crisis, and I'm personally in my house in lockdown. Probably 2/3 of the country is in lockdown right now. But we will get through this like America always does. But I believe that this is going to be a catalyst that really kind of drives change through the system. Talk to me about your view of that dynamic.
So, well, first of all, one of my sons has CP.
Okay.
And so he's mobile, but he has a really hard time, even getting phlegm out of his lungs. So he's like, if he gets it, we're fearful that he would even die.
Yeah.
So we're locked down in our household. We don't even let our granddaughter come over if we know she went to Walmart that day. So,
it's scary stuff.
But beyond that, of course, do all your protective stuff. And as a matter of fact, I did put a video out there on how to design an isolation room in your house. somebody in your family does need to be
quarantine
isolated.
Yeah.
Yeah, and it's basic stuff. But I think, to your point, that this is going to be, and a friend of mine and I were just talking about, okay, what is going to change? And just one thing that came out of the pandemic in Europe in the 1700s was bless you. So the reason we say bless you to people who sneeze, it's not just a, hey, bless you. It's back then it was, God bless your soul because you're going to die.
Right. Yeah.
And it just can't. So who knows what's going to kind of come out of here from a societal standpoint, but healthcare is going to change drastically.
Yeah. I mean,
all of the rural
hospitals, how critical health is to society, right?
All of the rural hospitals that were already almost dying are dead now. I mean, they're not generating any income right now. They're laying off their healthcare. I mean, I saw a Kentucky hospital laid off 400 of their employees. And I'm like, why is a hospital laying off anybody? They should be staffing up, to take care of all this stuff. And it's like, well, because nobody's going to get their procedures. Right. And they're
not allowed to do it. So
right.
It's a really sad thing that I don't know that's really hit, but I'm watching it, is that the kind of the ground zero for this fight against COVID is in all of those hospitals.
Yep.
And those workers are killing them, taking risk, and they're on the front line, saving people's life and taking significant risk to their own person.
Yep.
And yet the very act of this ongoing epidemic kind of viral crisis is that you're exactly right. The financial performance is going to be really bad. And all of there's 5,000 hospitals in the country. Half of them were month to month on making their bond payments or paying their loans, and they can't sustain more than 60 days. The federal,
it goes all the way down to the physician. I mean, we're one of my partner's clients. He's a health benefits guy, and he has a lot of physician practices as customers, and they're not open. So they're a small business, so they have to close. It's everybody. It's going to be pretty devastating. I think if this doesn't end within a couple of months, we are going to hit a depression. It's going to be financially, it's going to be that bad.
Yeah. So I'm building I do scenario planning for my investment business. We're mapping out a set of different scenarios. It'll be 3 or 4, and they won't be right, exactly right, but they just give you a sense of how it goes and where to invest and where to avoid. There's some scary stuff. I think I'm hopeful that we come through it, and it is it's 60, 90 days, and then we start coming back to normal. But no one knows right now.
Well, at the end of the day, and this is the non-empathetic, non-sensitive perspective.
Yeah.
We're going to come out of this stronger than we were before. Mm-hmm. And the market will then go up double of what it was before. Now, it might take 20 years.
Right.
But for those that make it through, and we might have a period of hopefully we're not going to get to the point where we all agree that the Green New Deal is a smart idea, because the New Deal was not a small idea from after the Depression.
Right.
So we'll see all that. Hopefully we can use market forces to ramp us back up a lot quicker than what the government can do for us. But I think at the end of the day, there's an opportunity for us. So I'm almost 60. So I was looking at, I'm never going to retire, but I was looking at the retirement time of like 75, somewhere 72, 75. So I'm going to be, now the official is going to be pushed off.
Right.
beyond that now, but I'm planning on living to be 150 years old now. It used to be 115, but after all the stuff I'm learning about in the aging world, the anti-aging world is like, there shouldn't be a reason why we can't live to be 150 years old.
Well, I want to come back to that, because that would be a record. I mean, I know a lot of people looking.
Yeah, 122 is probably the record.
Yeah, right. So, but let's come back. I mean, I think before this COVID-19 crisis, I saw trends in consolidation, in struggling hospitals and doctors, in technology coming to drive efficiency, but also consolidation and kind of the rise of consumerism, consumers taking control and looking for brands, and then kind of the entry from non-traditional healthcare players. So Walmart, Amazon, things like that coming in, not just your local hospital, but Walmart's delivering care now. That was happening. I mean, the reason I called it the health storm, that was happening last year, but it was coming along sort of in a slow, steady pace.
Yeah, but all that started in the early 90s.
Right.
I mean, when we were doing all that managed care stuff, hospitals were starting to consolidate and get bought out and all that kind of stuff back then. So it's taken 25 years for that to happen.
Right. So do you think this crisis catalyzes it, or do you think it's another 20 years of kind of just rolling along?
Oh, no, it's not going to roll along. It's going to change.
Yeah, that's what
I think. There'll be fewer payers. It'll be interesting to see who survives from a model standpoint, where the publicly traded companies survive, or whether the locally funded health systems survive.
Yeah, I think my bias is it's going to be bigger. Scale matters. So whether you are Ascension, which is a not-for-profit,
right,
but very large, well-capitalized, great management team.
Yeah, they make plenty of profits. They just don't give it to them.
Right, they don't pay taxes. Or your HCA, your tenant is immaterial. Like, I think scale and having size is going to be.
I agree with you.
Yeah.
Well, and all the academic medical centers will probably make it through because they're so big and they've got all the subspecialties that matter anyway.
I think we need to figure out how to structure things, but our country needs the research. But like we want the medical research that's done in those facilities.
Right.
They need to restructure how we pay for that and how they deliver care. But the research side is really important.
Right.
Talk to me about timing. Of course, right now we have this crisis going on, but I think the recovery is going to happen in a couple of different phases, right? So you have, right now it's all hands on deck. Let's try to prevent the spread of the disease and treat the patients that get it. No one's really thinking much beyond that. But then there's what I'm calling recovery and then new normal, that like we start to come out of it. And the status quo is not, let's go back to the old way. We sort of like public health, for instance, I think it's going to be very different after this. We're going to
there's going to be a continuous emergency management profile.
Right. We're going to be monitoring the spread of infection on your cell phone, or similar to 9/11. We're going to learn from the crisis and then implement tools that maybe impinge on personal privacy somewhat for the good of the general public.
Yeah, and I think we can do that without violating the Bill of Rights and the Constitution too much. It all depends on who wins the election, because if the left wins the election, then they're going to work really hard on making sure that the government drives that. Not just drives it, that the government owns it. So we're going to have to be careful about that, which is a whole nother interesting thing. So, we were working on some blockchain-based election systems that were getting poo-pooed because of the gaffe in Iowa and all that stuff.
Yeah.
But now they're coming around as well. This might be the way that we're going to be electing our people now, right?
Yeah, all these technologies are need to be included and incorporated. Blockchain is an incredible technology. It needs to be kind of implemented in a way that really delivers the best good. But it's a great technology that should. I think similar to the internet, there's not going to be blockchain health companies and other health companies. It's just going to be like everyone uses blockchain for various purposes.
Well, when I do my blockchain 101 class, I actually talk about the different industrial phases of where we got to, and blockchain is as important as the internet is.
Right. Yeah, it's a protocol layer.
Yeah.
It will be really important in transaction processing of data and money and different things, but people will use it for all different purposes.
And it'll be a tool, because at the end of the day, it's not about the tool.
Yeah,
the tool will hide in the background, and it won't be a hoopla type of thing like it is today. It'll be just like the internet is today. Whatever.
Yeah.
So we're looking forward to those, man. We've been pushing legislation in the state of South Carolina to get the regulations around fintech and some of those areas that would ultimately control a blockchain solution, to make sure that our South Carolina is prepared and enables that type of emerging technology to come out. As a matter of fact, our governor in his State of the State specifically spoke to that, that we need to get South Carolina our framework set up so that we are facilitating the adoption and creation of emerging technology, not just, those guys are doing that over there, great. We gotta make it happen.
That's pretty cool. I didn't realize that, but it'd be interesting for South Carolina just to try to live. I've been to Greenville. Greenville has some great stuff going on up there.
Yeah, Charleston and Greenville are kind of our lead tech hubs.
Right.
So yeah, Greenville's really, really good.
Yeah. Okay, so let's dig into the food as medicine piece. So what are the learnings that you can share over the last 10 years or so as other people in the audience want to start adopting more healthy food?
So I think our food is going to be our precision and personalized medicine, because at the end of the day, and I don't know if do you know recall the name of the Flexner report?
No.
So the Flexner report was an assessment of all the medical colleges in the early 1900s.
Okay.
And they were pushed by the government and the AMA to standardize all of the medical schools in America. The problem is the AMA and the government had the mindset of the fix-it, which is the medical system that we have today.
Well, that's what was. Trauma was the biggest health issue then.
Right. So they were all about fix it, but then they termed quackery functional medicine and chiropractic care that is prominent today. So they squashed that whole. They barely even didn't allow osteopathic schools to exist anymore. They gave those guys an option to say, okay, well, we'll call you MDs, right? So a lot of the technologies that are coming back today, because we're discovering them, is around how we can help the body heal itself.
Yeah.
And
I was talking, and I have another video with Dr. Mark Watkins from Kroger. He's the chief medical officer at Kroger, and so he's an MD, and he of course went through medical school and residency. I think he said, I'm not going to get it right, but he had 6 hours of nutritional training.
Yeah, nothing.
I mean, they basically don't train docs at all. Though.
And then it's probably an elective. I think there's only 8 medical schools in the country that now teach a class on nutrition.
Yeah, like a full class.
As a requirement, as a required course.
Yeah.
And so I think because technology is coming back around and people are understanding and we get to meet people all over the world. As a matter of fact, I just wrote a little piece about 5 years ago. The Augusta University's Medical School of Georgia, we actually partnered with medical universities in China to develop a Confucius Institute of Traditional Chinese Medicine here in Augusta. Amazingly. Yeah. And so that's where we're starting to then teach the health professionals about the benefits of traditional Chinese medicine. And really that's all based from herbs and natural, it's the stuff we eat and the stuff that our God designed bodies were created to be nourished from. And so we're coming back to this. We're coming back to, okay.
So talk about what your regimen is and how you think you can beat the record and live past 120 to 150.
Well, so I always said 115 because of my genetics, but that was before I learned about nutrition.
Okay.
So my mom and my mom's side of the family, they lived to be in their late 90s, and my dad's side of the family lived to be in their late 90s, and a lot of them smoked and drank until they died. So the genetic pool is pretty good. So I said, well, okay, we got a little bit of advanced medicine that I'll probably be able to tack on 15 or 20 years to that. But now, after researching longevity, aging, and how nutrition plays into all that, and especially a lot of the work that Dr. David Matthews up at MIT and Harvard has been doing is, they're discovering ways of which to re-energize our cellular makeup in a way that's natural, but gets it back to where it was at the age of 20 and 30. And we can do that if we get rid of the bad foods and eat the good foods. And there's a lot of people that talk about, a lot of physicians that talk about that, and nutritionists and everything. So people can go discover that. My favorite sources are How Not to Die, How Not to Diet. Those are by Dr. Greger. And then The Longevity Paradox, and that's Dr. Gundry. And so there's a lot of sources out there to talk about, but we got to get away with the way we're doing things today.
So your regimen, and you don't need to go through it all, but it's pretty detailed, like what you eat and drink during the day.
Yeah.
And I want to see, like, how would you translate? So first of all, describe that, and then how do we translate that to kind of regular folk that have a hour-long commute and they're working at a job, sitting at a desk, and then have to get home and feed the kids and do homework and get to bed?
All right. So first of all, I'm a regular guy too. So if I can do it, anybody can do it. Okay. So all you have to do is
what is it? Because when I heard it, it seemed like a lot, but maybe I just need to pay attention more.
No, it's just so if you do the same thing every day, then it becomes a part of your life. Mm-hmm. So the first thing that I ever did was I have a stand-up desk. So I don't sit down to work. I try really hard not to.
Yeah.
I mean, I'll put in a 14-hour day standing at my stand-up desk.
Yeah.
But while I'm doing that, I'm doing squats and I'm stretching and I'm doing activity that then adds on, so I don't have to do too much exercise.
Yeah. Okay.
But I do wake up.
More like weave it in through the day.
Yes.
Yeah.
Which is the best way to do it anyway, because first of all, you're not wearing yourself out. And then you're still activating your muscles to burn calories throughout the day. So that's one major benefit. Now I do wake up at 5 o'clock almost every morning.
Yeah.
And I have a
came out of the military, so they ingrained that in you probably.
Yeah. Well, so yeah. My wife does too. So
Yeah.
so we she's the one who got me into triathlon. So oh my God, when we started dating, she bought me a bike to make sure I was going to bike with her before we got married. So so I had to learn how to do all that. But anyway, and before that, I was an ultimate Frisbee player, played in 2 world championships. So, so I've always been healthy. I can't say that because a lot of athletes aren't healthy, but I've always been active.
Yeah.
But yeah, so we wake up before anything else happens, before we wake up the kids, and we have a workout. And I've got different regimes, kind of P90X, beach body stuff.
Yeah.
I try to do that as much as I can. I don't have any arthritis. My wife has signs of arthritis now, so she's kind of slowing down on that really aggressive stuff.
Right.
But I don't do it real hard either. So
yeah,
I am 58. But it does keeps me good and healthy. And then and then the other important thing in the morning and then throughout the day is water. Mm-hmm. So the first thing you have to quit doing is drinking any canned drinks. I don't even care if it's canned water.
Yeah. So this LaCroix, you don't like the LaCroix?
Yeah, they all taste great, man. That's about it. They don't. The energy drinks are killing you.
Yeah.
You don't need it. You do not need the stuff that's in the energy drink. If you're an athlete and you just ran 5 miles and you want to do a Gatorade or something like that after you ran that 5 miles, okay, you earned it. That's okay. But do not drink Gatorade during the day as your energy drink. That's the stupidest thing on earth.
Right.
Coca-Cola. I mean, I love Coke. I own Coke stock. I love the story of Coca-Cola. Yeah. But that stuff's bad. That's crap food. Bad for you. Right. So just get away from all that. Quit going. As a matter of fact, if you saw my video, oh my God, KFC just came out with their fried chicken patty with donut buns. Right. I'm like that.
It's just for the audience that has, you should go check out on the internet. It's a fried chicken breast with 2 glazed donuts as the buns. And
it looks amazing only because it's got to be just the stupidest thing I've ever seen.
It's just like over the top, ridiculous.
It is. But people are eating it because they tried it in a little market and they did so well that they expanded it to the whole nation. Yeah. So it's like that is what we're doing to ourselves. Okay. Right. But anyway, so for breakfast, I've got a whole regime of supplements from prebiotics to probiotics to a lot of the stuff that we talked about in regards to how to trigger the NFR1, NFR2, and the sirtuin pathways within your cells. But then it's eating a good balance. And I'm not a vegan because I still eat my poultry. We just ate some great blended beef patties for hamburgers tonight. Yeah. So I still eat that, but now I'm piling on. I mean, if you look at my plate now, it's a meat is probably 1/4 and 3/4 of it is vegetables. Yeah. So you got to counter your protein because your protein, you really don't need a lot of protein every day.
Yeah. So I'm a pescatarian and I started this maybe 2 years ago. Slowly giving up one thing at a time. So I first gave up Diet Coke. I used to drink a ton of Diet Cokes all afternoon, basically. Then I gave up alcohol. That was probably the hardest thing to give up, just because it's socially. Right. I don't know. People just like hang out and have a cocktail. And then I gave up red meat and chicken. I tried to go all the way to vegan, but it was too hard to just live your life. And you go on a work trip or something and you can't eat anything. So.
Oh, sorry, baby. That was my wife.
Yeah,
I thought I was one of those kids.
Yeah. Yeah, the kids will go away. The wife doesn't worry about
now she's mad at me. So
I find that I don't miss it that much. I mean, I like a little bit of fish is good, but you don't need that much protein really.
Right, right. Well, in regards to your drink thing, so yes, I mean, we don't really drink at all anymore. Not that we've written it off. It's just, it's not important to us.
Right.
But when we do go out, the easiest thing to do, especially during the summer, is just to get a club soda, put a lime in it. It looks like you've got a vodka tonic.
Right.
So,
Yeah.
and that's the only carbonated drink I'll have is a tonic water or a club soda.
Right.
But anyway, so
how long have you been eating like this?
Well, we've been eating the all natural foods for 10 years now.
Okay.
Um,
And how long was it before you felt you could see a difference in yourself or your kids?
well, so we weren't doing it purposefully.
Mm-hmm.
So we weren't measuring.
Yeah, you weren't
It wasn't until last fall when I started just thinking about, okay, why are we so healthy? Did I realize why we were so healthy?
Yeah.
So we weren't purposefully doing it. We were just smart enough to buy foods from a company that provided that type of food.
Yeah.
And so,
And it tastes better. I mean, I think it tastes better. Yeah.
Well, it's beautiful. I mean, so we vine ripen the vegetables and then we are vacuum sealed in a flash freeze them within 8 hours of being picked. So they're not only beautiful, vine ripened, but I would put that food up against any other vegetable on earth and measure the nutrient value of it. Because there's no other vegetables in the supermarket that is being served to you within 8 hours after it's taken out of the vine. And broccoli, for example, loses 75% of its nutrient value within 72 hours of being picked. So
that's incredible. So
yeah, so the food in your store, the average distance it travels is 1,000 miles. So there's no way that broccoli in the store came from your local farmer. It came from somebody else, and it took more than 3 days to get there.
And it's still broccoli, but it's lost a lot of its nutritional content.
Yeah, it's still green.
Right.
And then you got to steam. And I recommend steaming all your vegetables. Do not boil anything.
What about broiling? That's what I do mostly.
Yeah, so broil whatever it is. Steaming's good because it doesn't beat it up so much.
Yeah.
There's still a little bit of the residue that is in the boiled water, but it's not nearly anything like boiling the vegetable. But broiling is great because it actually probably retains it even more and locks it in.
Yeah.
And then we pan fry stuff in some good olive oil stuff, and that's a good way to do it too.
Okay, good. So I want to talk to you about what you've been working on, health and innovation and tech, and then some diet now for 30 years, for a long time. What do you know now that you wish you knew in 1994, whenever you started?
So, well, there's a lot of things, but from a career standpoint, I'll talk about that in a minute.
Yeah, just in general. What are you?
So what's interesting? I just found a technology out of Germany that we're bringing into the United States.
Okay.
Hopefully, we just got FDA clearance for it as a Class 2 medical device, and we're hoping to be able to provide it to the market in May. And then it's based upon technology that Tesla discovered in the late 1800s.
The real Tesla, not the car.
No, the real Tesla. And so it's based on electricity. And you remember I was telling you about the Flexner report. So there were actually doctors who were taking care of patients using frequency therapy in the early 1900s. And because of the Flexner report and the medical school changing and all that, those guys got thrown under the bus because they were said that they were quacks because it wasn't under these new guidelines. So that technology was lost until 1990, when it was rediscovered, and then it started to be used by functional medicine people, physicists, and other types of healthcare professionals that weren't MDs, who believed in alternative methods of healing. And so now this thing is actually in a consumer-sized wearable device. And so we're going to be announcing all that pretty soon. But if it would have been great that my grandparents would have known about it, and then they shared it with my parents, and then my parents brought me up on it. So now I'll be able to share it with my kids, thankfully. But it's just stuff like that we're not innovating. And I have a whole talk on the difference between innovation and evolution. And it's not evolution as in man evolution. It's in evolution of invention. So does anybody ever invent anything, or do they just evolve based upon other blocks of knowledge that were created, right, or discovered?
Yeah, I think there's a lot of value in, I would call it cross-pollination of ideas. Like,
absolutely.
For this video series is I'm trying to reach out and get different perspectives to all kind of put into a bucket and then shake it up and see what comes out, which is really going to be really cool.
Yeah. Yeah. So but I was stupid. I was still kind of dumb back in the early 90s. So I just knew what the business.
If you told yourself this, you may not have listened back then.
Yeah. I said, my dad was a non-invasive cardiologist. So he was a kind of a primary care in cardiology. So he was kind of an innovator from the standpoint of, we don't have to open you up to fix your heart. We can do it in other ways. So I had a little bit of that in me, but then I was, I did my training at the Medical University of South Carolina, which is a conservative state, a conservative medical school. And so that whole mindset was there, even though I saw the benefit of full risk managed care, but it was all business. It was all business. Yeah. So back then, it would have been nice for me to have been this way, but until and this is one benefit of getting married early and having kids early, is you actually earn a crap load of stuff by being a parent.
Yeah.
And I wasn't a parent until the age of 45. So I missed 20 years of learning from my kids.
Yeah.
That I didn't have. So getting married, 12 years, starting to have kids and all that really helped my frame of mind to be even more open to things.
Right.
Even though they drive me nuts.
Right. Well, it's both. They're the best thing for you, and they're also the hardest thing. Right.
Yeah. Yep. But that's probably it. I actually often think about if I had known now, if I'd known then that I do now, I would go back to when I graduated from college. And what would I have done instead of doing what I did? And while I have a lot of great experiences.
You went into the Army, is that right?
Well, I wouldn't have done that.
Yeah.
I would have done that. And then I would have gone into real estate and become a real estate investor.
Huh. Okay.
And I would have I lived in Charleston, South Carolina. Yeah. Charleston, South Carolina went from this little nice historic town 25 years ago to now 500,000 people.
Yeah.
And the traffic is horrendous. And all the real estate guys from when I graduated from college are now wealthy.
Yeah, killed it. Yeah.
Or at least the smart ones. Yeah. But anyway, so if I had to, I'd go back to that. But otherwise, I love my life now.
Yeah.
I still have another 60 plus years to go, man.
You're 58, you got another 90 years.
That's right. Yeah. So I can screw up tomorrow and still overcome that. So.
Yeah. Okay, and then the last thing, Gordon, super fast-paced world we're in now with health innovation changing all the time. What do you recommend people read? What do you read to keep up with this, or what do you watch? Like, how do you keep up with all the news and all the stuff around health innovation specifically?
For health, I follow the blog guys.
Who's your favorite blogger?
I don't have one.
Okay.
Because they all have their angle, which is fine.
Yeah.
This is fine. I used to be in a couple of groups and I was real active with all that, but they all have their they all have their perspective and their angle, and which is all good, but I just didn't have time to deal with it.
Yeah, right.
So I read them all.
Yeah, and then
I don't interact with them as much.
Yeah.
But I mean, I'm across the board, not just. I'm at the employer. I really focus on those guys working with employers, because right now that's where the change is driven. If you can convince an employer to be self-insured and be innovative, you can make a lot of change.
I agree. I think the real place of change is the self-insured employers, and then Medicare Advantage specifically.
So if we can, and that's only because the government's handed that off to
it's capitated risk.
Yeah. So as long as we don't have Medicare for all, and that we'll be fine. So working with employers who are innovative and understanding and then all that is really good, because they pretty much get it. The smaller self-insureds still don't know that they're actually operating probably almost as big as their company. They're operating a healthcare company, right? Because 30% of their employees' pay is in health benefits. So
yeah, I mean, it's the second biggest expense on their P&L.
Yeah, absolutely. Absolutely. So every employer is in the healthcare business, whether they realize it or not. So that's where I think a lot of the innovations can be pushed, because it's really hard to work with the physicians, because they're still going down the path of fee for service. So they're all still churn, and they're still got that mindset, even though 20% might be in some kind of value-based contract or something. They don't care, because it's a patient to those guys.
Right.
And until they change the whole philosophy of the practice.
Yeah, until it all shifts, they're just in there doing their thing.
Yeah, they're just a labor, man. For the most part, except for the guys who own the practice, who are running the business, but for the most part, health professionals are Joe plumbers, just like everybody else.
It's piecework. Like every time you do this thing, you get paid money.
So no offense, because y'all do real well, y'all life-saving work, but at the end of the day, it's like, I believe in consumerism. I truly believe that if we can figure out a way to communicate to the consumer to change the way that they're doing something, that will then come back and push back into the health system in some form or fashion. And so that's really where I try to focus.
That sort of drives the efficient market, right? A bunch of consumers making choice and going towards efficient, high quality, good price services, then drives the whole business that way.
And I don't know if you saw the controversial post I sent out a couple weeks ago.
No.
So I did a video about how I believe network marketing can save healthcare in America.
Wow. Okay.
And if for all those that know what network marketing is, you call it a pyramid scheme, but it's really referrals. People like what they're doing, and they tell other people about it, and then it's actually more like the cow gong commercial from a long time ago, where it was the girl did up her hair and she loved it. She told another and she told another and that's really, if we have a good idea and we can incentivize the believers of that idea to grow it, then it'll get out there a lot quicker than being driven by some payer that's going to make 2 years to make a decision to push down some business model, right?
Yeah, I mean, so I'm a VC, right? So great ideas can get launched and be successful. The multi-level marketing or network marketing, that's just a distribution strategy.
Just
so it's no different than franchise or doing a startup or a government thing. They're all just different ways to get that product out to the market. Right. I think they have pros and cons.
Oh yeah, all of them do. There's shysters in every business.
Yeah, that's right. And there's great people in every business.
That's right.
There's reasons to use network marketing, and there's reasons not to use it. So I think it's great for some products, and it's not good for other ones.
Right. Well, you're not going to do cardiac bypass network marketing.
Right. Yeah. Exactly. I mean, in my mind, just quickly on that, like network marketing, I think it has to be easy to explain and sort of fairly simple, but you need also a recurring, like somebody to sell in a recurring way.
Right.
Otherwise, the network doesn't work. It can't explain the product, and then it doesn't get residual.
Well, and that's why your product has to be subscription based.
Right. Or you need a consumable.
Yeah.
So
but then, but if it's all the, I mean, I'm a big. So we go back to some of the books we read. So I'm a monthly buyer of Kindle, and I'm a monthly buyer of Audible.
Yeah.
I mean, I've got a gazillion books, digital, and so I'm a big believer in the subscription model, because I believe at the end of the day, I probably get more value out of that model than other people do, because I listen to books every single day. So I don't watch TV. I'm either reading something or I'm listening to something all the time. That's where I get all of my information.
Right.
I mean, one news source I do listen to on Audible is the Wall Street Journal. So they push out an Audible of 5 stories every morning. And that gives me enough of an overview of what the hell's going on out there.
Yeah, so right. So. Okay, great. Well, Gordon, thanks for your time. I really enjoyed this. It's been fun.
No, yeah, same, man. I appreciate it.
Stay safe down there, and hopefully we'll get through this COVID thing.
Yeah, we will. We'll do that together. It's going to take us all.
Right.
Absolutely.
Right. Okay. Have a good night. Thanks for doing this. Appreciate it.
Thanks.